Okay, so now let's talk about medical records. How you collect them, what you collect, what's important, what's not. Do you actually have access to your own records? Unless you work in a healthcare field, it may be confusing to know how to read the notes and what kind of notes there are, so let's go through that now. When you look at a patient's medical records, there's a few major categories. The visit or progress notes. Visit notes are documentation of a patient's visit to a healthcare provider. These notes typically include a summary of the patient's medical history, physical exam finding, a diagnosis, and treatment plan. Visit notes are used to track your progress and to communicate important information between your different healthcare providers. The medical history. This includes information about your past medical conditions, illnesses, surgeries, treatments, and so on. It helps your healthcare providers understand your health status and develop appropriate treatment plans. Medication information. This includes information about your current and past medications, including the name of the medication, the dosage, the frequency, and the duration of use, or how long you used it. It helps your healthcare providers ensure that your medications are appropriate for you and safe, and that there are no dangerous interactions. Family history. This is my favorite part. This includes information about your family members and their medical history. It helps your healthcare team identify any potential health risks for you, and if you need to be referred to someone like me, a genetic counselor, or some other sort of specialist. It also helps them develop a plan for the most appropriate preventative measures, which we'll talk about later. Treatment history. This includes information about your past medical treatments, including surgeries, procedures, and therapies. Procedure reports. Procedure reports are the documentation of any medical procedures that you may have had performed on you, such as surgeries, diagnostic procedures, or imaging. These reports typically include information about the procedure itself, the outcome of the procedure, the date and time it was performed, the name of the healthcare provider who performed it, and any complications or findings. Procedure reports are used to track your medical history and ensure that the procedures are performed safely and effectively. Pathology reports, or path reports, are documentation of the results of any tissue biopsy or diagnostic tests. If you've had anything removed, it usually gets sent to a pathology lab where they look at it under the microscope and may do a slew of tests on it to learn more about that piece of tissue. These reports typically include information about the type of tissue or cells tested, the findings of the test, and any diagnosis or recommendations for further testing. Pathology reports are so important in diagnosing medical conditions and guiding treatment decisions. Lab tests. Lab tests are diagnostic tests that measure the levels of various substances in your blood, your urine, or other body fluids. These tests can be used to diagnose medical conditions, monitor the effectiveness of a treatment you're on, and screen for certain diseases. Lab test results are typically reported in a numerical format and will be compared to a reference range that will usually be on that report to determine if you fall within normal limits for whatever that test was. Sometimes you may have a lab report that says you're a little above or below the reference range, and that might just be normal for you, which is another reason to have a baseline test when you're healthy. So you can determine what your baseline numbers are and see if they change. And genetic testing, my favorite again. A genetic test is a medical test that examines a person's genetic material to look for changes or variations in their DNA that may be associated with a particular disease or condition. These tests can be used to help diagnose genetic disorder, predict the likelihood of a person developing a certain condition, and identify carriers of genetic changes or mutations. Genetic tests are typically performed on blood or saliva and sometimes on some other sort of bodily tissue, depending on the test. And the results are typically analyzed in a laboratory setting. These tests can be used to look for a variety of different types of genetic changes in the DNA. And it's important to go to a person who understands genetics and how to interpret and order these tests so that you have the one that's appropriate for you and most affordable. Genetic testing can be done for a variety of reasons, including diagnostic testing to confirm or rule out a suspected genetic condition, carrier testing to determine whether a person carries a gene mutation that could be passed on to their children, predictive testing to determine a person's risk of developing a certain condition in the future, prenatal testing, which is done during pregnancy to determine whether the fetus has a genetic condition, pre-implantation testing. This is done on embryos prior to in vitro fertilization or IVF to screen for genetic conditions in the embryo. Genetic testing can provide important information about a person's current or future health status and can help healthcare providers make informed decisions about their medical treatment and management. However, it's imperative to understand the potential risks and limitations of genetic testing, as well as psychological and social implications of genetic testing. Other parts of the patient record may include a medical record number, or an MRN, and this is a number used to identify a patient without using their name. Identification information. This is the part of the medical record that includes personal information about the patient, such as their name, age, gender, sex, address, and contact information. It's used to identify the patient and ensure that their medical records are accurate and maintained well. Medical directives. This includes information about a patient's medical directives, such as advance directives and living wills. It helps healthcare providers understand the patient's wishes for medical treatment and end-of-life care. Consent form. We're going to talk a little bit more about informed consent later in this course. Consent forms include documentation of the patient's consent to medical treatments and procedures. This helps ensure that patients have been fully informed about their medical treatments and have given their full consent for those treatments. Insurance documentation. This is just information about your current insurance plan so that the medical administrators and billing staff can bill you accurately. All of these types of documentation are important for tracking a patient's health status and guiding medical treatment. Medical offices used to use paper files, but there were a lot of issues with that, like a fire or something getting lost. But now the majority of medical offices use electronic health records or an electronic medical record system. These systems come along with patient portals where you can log on as a patient and see your own information and communicate with your providers. Signing up for the patient portal is an important way to organize and access your personal health information. Each health system typically has its own unique portal, which may or may not communicate with others. The portal will allow you to review your after-visit summary, which are your instructions for after your visit, as well as any notes that are completed. It allows you to ask non-urgent questions, and you can upload photos that you want to share with your team. In some places, COVID testing results, as well as other labs, are available immediately. Most of the time, lab results are available in a few days, and sometimes even the same day. In many cases, you can also self-schedule an appointment and not have to call in or worry about figuring out your schedule and playing phone tag with a receptionist. The patient portal is an important part of communicating now, and patients who use it effectively are very happy with it. So now let's talk about tools you can use to keep your records together. I often tell patients, especially those with any type of chronic disease or any diagnosis, that it is really important to keep your own patient records, because if you were to move or you were to see a new provider, there's no saying if those records are going to be shared, and it is important to bring with you. So there's a few ways to do this. One of these ways is to create a binder. You can actually make your own binder with your papers in it, but I prefer to go paperless. If you do want to make a binder, I will include a list of the different tabs or categories of records to keep as the tabs in your binder, or the sections. Now, personally, I really like a service called Picnic Health, which is one of these electronic services that requests records from every physician I've gone to see, and they display it on a beautiful timeline, and it allows me to actually compare my results over the last 15 years, which is amazing. Now, you as a patient are actually entitled to reading your own record. The 21st Century Cures Act has a provision called the Open Notes provision, and with Open Notes, as soon as a note is closed, the note's available for the patient to read. This holds doctors more accountable. When you do access your own notes, keep in mind that they are written for other medical professionals to read. They're not intended for patients. So they're going to be written in medical terms with abbreviations that you may not understand, but you can ask for an after-visit summary that should be written in patient-friendly language. So just to give you a little example, my mom went in to get a mammogram, and she happens to be a physician. She had her mammogram, and then she looked at the results on her portal. And she saw on the note that it said normal tissue, breast implants present. She doesn't have breast implants. So she called the radiologist office and asked to have a different doctor look at it, because she felt that if they had made a mistake like that, saying she had breast implants when she didn't, they may have also made a mistake in reading her report. So she requested someone else to read it, and they did and fixed it. And this was only possible because she was able to see her own medical note. Imagine if something had been missed. It only would have been caught because she advocated for herself. And that's something you can do as well. If something is wrong, make sure you let your healthcare providers know. And you are absolutely entitled to ask for them to reread something or re-report something if there's a glaring error.